Hi, welcome back to Dr. O'Donovan, Medicine Made Easy. Today's video is going to be a brief but hopefully very useful clinical video on something called FORDYCE spots. The reason I'm making this video is because recently a patient came to see me in clinic complaining of these small white spots that had seemed to appear in clusters on the penis, and they were wondering whether or not these could be a sexually transmitted infection. However, these were FORDYCE spots, and I'm going to give you some real-life clinical examples of these and lots of photographs over the next few slides. But essentially, as you can see in this photo here, we've got these raised little clusters of bumps. These are visible ectopic sebaceous glands, so essentially the oil glands without hair follicles. And they're usually located on the penis, however they can also be located on other genital mucosa, especially in women, and also in the oral cavity. This is another example of these little clusters of FORDYCE spots, also known as FORDYCE granules, on the shaft of the penis, and here you can see it on the lower border of the lower lip. So FORDYCE spots are present in about 80% of adults, and they probably present at birth, but they can become bigger and more visible from puberty onwards. It's important to note that they are not a sexually transmitted disease and they're not infectious. So let's go ahead and take a look at some more classical findings of FORDYCE granules or FORDYCE spots. So here again you can see this clustering here, and also again in this image you can see them, and this is the shaft of the penis with glans penis here. So they're small, usually 1 to 5 millimeters, slightly elevated, and they can be yellowish or white papules that appear on the inside of the cheeks, the mammalian border of the lips, the glans or shaft of the penis, as well as the vulva and the vagina of the female. They can occur as a solitary lesion, but more frequently they occur in crops of around 50 to 100 of these lesions, and you can see here this little cluster around here. They're easy to see when the skin is stretched, and they're diagnosed clinically, i.e. the doctor or the health professional will make the diagnosis just by looking at them. In terms of treatment, well, they're generally harmless and don't require any treatment, but avoid picking or squeezing the spots. If you are concerned, worried, or have any questions, please don't hesitate to contact your nearest health professional who will obviously look at these and examine them. I hope that was helpful and useful, and if you've got any questions, please leave them in the comment box below. I've also included lots of useful links in the description box of this video for extra and further reading, and if you haven't done so already, please remember to like this video and subscribe to the channel for new videos every Wednesday and every Sunday. Thanks for watching, and until next time, bye.